Whether it's for cosmetic purposes or reconstruction after breast cancer, Plastic Surgery Associates in downtown Grand Rapids. They've been providing life-changing results.
So what does it mean to be under the care of a board-certified plastic surgeon, and then what types of procedures are available? We sat down with Dr. Krebiehl for today's Trusted Advisor segment. Whether it's the wrinkles on your forehead or the 11s because you're like me and you're really expressive, or you have something more serious that you need done like a hand surgery, why don't you go ahead and turn to the wonderful professionals at Plastic Surgery Associates in downtown Grand Rapids. Let's take a listen.
So here at Plastic Surgery Associates, there's 4 of us partners who operate here. We offer the full spectrum of plastic surgery, from body contouring, breast reconstruction, breast augmentation, breast reductions, tummy tucks, mommy makeovers, facelifts, and then we also have a spa as well. And in the spa we offer facial rejuvenation, laser treatments, fillers, Botox, all of that kind of stuff as well. After medical school, you have 6 years of residency training. Some people will do 5 years of general surgery followed by a 3-year plastic surgery training as well. After that, some people will choose to do a fellowship, which is a specialized 1 year, either hand, cranial, facial, other types of things that is specialized. And then after that, we take a written board exam. It's a very rigorous exam that requires a lot of knowledge on plastic surgery. You have to pass that in order to continue through the board certification process. After 1 year of training, we go through a oral board, which is where someone actually is physically examining you on your cases that you've done, as well as some unknown cases. So I'm also certified in hand surgery, both plastic surgery and hand surgery. So the board certification I talked to earlier about for plastic surgery, the exams that we had to go through in the training. For hand surgery, I completed my plastic surgery residency, which was 6 years. Then I did an extra year of hand surgery out in Los Angeles. And then following that, after 2 years in practice, I actually took a specific hand surgery exam to become certified in hand surgery as well. Something I came to pretty early in my plastic surgery training, knowing that I just really enjoyed the hand. The hand is very complex. There's soft tissue, bone, nerve, tendon, a lot of intricate structures, and so I really enjoyed working on that area. It's also very important in our daily functional life, and so to be able to restore the function of a hand, to me, was very, very important. Plastic surgery is something that is a personal choice, and sometimes you really need just to have that courage to take that first step. And to me, the first step really is the consultation. So it's not saying that you need to necessarily do anything. You can come and just speak with one of us and have an idea as to what we can achieve for you or what is possible for you. And I think just having those discussions may make someone feel a little bit more comfortable with it. Unfortunately, a lot of women who do have breast cancer and undergo either a lumpectomy or a mastectomy don't realize that they actually have these options available to them for reconstruction. What we can offer is not only reconstruction with implants following mastectomies, but we can also offer autologous tissue where we're actually using the patient's own tissue, whether it be from their tummy, their back, those types of things, with an implant as well or not. Also, with lumpectomies, sometimes we can actually do a breast reduction or a symmetry procedure on the opposite side in order to allow them to have a more cosmetic appearing breast following cancer reconstruction. Being able to reestablish their personal appearance and feeling very confident and comfortable. Some of my favorite patients are my breast cancer patients, just because they something that cancer took away from them, we're able to help recreate for them. I think one of the really interesting aspects about Plastic Surgery Associates is just the vast amount of things that we offer here, including surgical and non-surgical, as well as the entire spectrum of plastic surgery, from breast, body, hand surgery. And there's a lot of plastic surgery offices and things throughout the city and different areas that you could go to, but we are able to offer so many of those things right here in one building. We have our own surgery centers downstairs that you can have your consultation here and also your surgery done here, which for some patients is very nice to have that privacy comfort of being in not a hospital setting. At Plastic Surgery Associates, we're being very careful. We're following all of the steps that we feel necessary to keep patients and ourselves safe, including social distancing, requiring masks when you come into our facility, as well as we have a special checkpoint when any patient or person with the patient comes in. They have to stop and get screened for those COVID questions. We're making sure that only the patient and any other necessary people are coming in with them. People to feel good about themselves is one of the most important and rewarding things that we do. Some people, I think, feel that plastic surgery may be frivolous or not necessarily important for them. And I think that being able to feel confident in your skin and in your body and who you are is really very important for a lot of people, especially during this time where so much has been taken away from us. To have that confidence helps you to get out there and be able to do the things that you want to do.
And Plastic Surgery Associates is located in the Amway Grand Plaza Hotel in downtown Grand Rapids. For more information, you can visit their website at psa-gr.com or give them a call 616-451-4500.